County, Kansas City, Kansas.
So out throughout the course of the last couple of weeks, there's been many activities going on in the community, in the region regarding the COVID-19. Over the last 24 hours, I think we've seen some major changes happening that we're seeing in the region with cancellation of national events, and then locally here, same impacts coming on as far as our considerations locally. So we've asked the health department, who is on point and working through this, to come over and give us a update on where we are with some items. So I will turn this over to Terry Garrison, our Director of Health, and let her proceed. Terry?
Good evening, and thank you all for being here. We just want to give you some points on where we're at, what we've been doing, and where we're going from here. And then I first would like to introduce our Chief Epidemiologist, Elizabeth Groenway. She has been really steering us in the right way with the COVID-19, and we have been following her lead. So I will turn it over to her.
Hello, everyone, and thanks for allowing me to come speak. So I'm the epidemiologist for the health department, which means that I'm kind of the primary point person for COVID or coronavirus activity and all the activities that we're doing here at the health department. As you can imagine, we've been very busy these last couple weeks, and so I kind of wanted to fill you in on some of the activities that we've been doing at the health department working on this issue. So we have been investigating a number of individuals, people with travel history or people with symptoms of COVID. We've tested a number of individuals within the last week. We've also been in regular communication with the other departments within the unified government to make sure we're coordinating our efforts and putting all the preventative measures into place that we needed to put into place within the UG. We've also been in regular communication with schools and with school nurses to make sure that they're informed. And we've also been collaborating with state and regional health departments to make sure that the messaging that we're getting out is consistent across other health departments and within our region. One of the new recommendations that we put forth earlier today that you might have seen via the Facebook Live press release is that we are now strongly recommending no large gatherings. Any kind of large gatherings, including churches, special events, sporting events, anything like that, we are recommending and strongly recommending that those not take place because of the risk of this virus spreading within our community. And this is going to be a very important measure going forward as we try to prevent the spread as early as we can. We don't want to look back a week from now and wonder, what else could we have done that we should have done. So we are strongly recommending no large gatherings. Anywhere where you can't guarantee 6 feet of space between you and another person is what we're considering a large gathering. Yeah, this really shouldn't be happening. And so these are the kind of things that I want you guys to think about moving forward within your districts. What kind of events are happening that you need to recommend not happen? So starting to think about those kind of things as we move forward.
So I don't know why this one is so hot. I'll ask it from way back here. All right, so one of the things so what you're saying, I've heard people define gatherings as few as 25 and as much as 1,000 or more, and what you're saying is consider the number of people you expect to have and the size of the space and kind of eyeball how those people will fit in that space, and if there's that 6-foot cushion around everybody, then you would say that would seem to be a reasonable number of people to gather. Is that?
Yeah, so at this point in time, we're not putting like a hard number on that because we really want people to think about, the virus doesn't know if you have 25 people in a room or 100 people in a room, if it's a crowded room and one person's infected. That's why we're not putting a hard number on it because, it doesn't matter. Anywhere where there's going to be a large crowd of people coming together, we're strongly discouraging.
especially if those people are packed close together to one another. All right, perfect, thank you.
And we did want to mention, too, that you have to consider the audience of this crowd. So like a bunch of people that are elderly getting together maybe for like a church congregation really would be a bad idea, because these, we know that people over the age of 60 are more at risk of having complications. We know that people with certain underlying medical conditions like heart disease, kidney disease, diabetes are at higher risk. So you have to consider what kind of gathering it is. But in general, we need to think about limiting any kind of gathering of large groups. So moving on from that, we also are really wanting to encourage citizens to take steps to protect themselves. Staying home when sick is going to be so important in these next couple weeks, and we need to make sure that we're putting that messaging out to stay home when you're sick, and making sure that employers are encouraging their employees to stay home when sick. Here at the UG, we need to make sure that we're encouraging across all departments people to stay home if they have symptoms of COVID. And again, those symptoms are a fever, cough, and shortness of breath. And so moving forward, very important that we get that messaging out that people need to stay home if they're displaying symptoms of COVID. And then again, we're also encouraging, basic hygiene, washing your hands or using hand sanitizer when you're not able to, covering your coughs and sneezes, avoiding, large crowds, keeping your distance from other people. All those good things that we've been recommending for the last couple weeks is going to be even more important going forward. We also want to remind people that if you're sick with symptoms of COVID, again, cough, fever, shortness of breath, make sure you call your primary care provider. We've gotten a lot of inquiries here at the health department about testing. We are not testing here at the health department because we do not have the capacity to test at the health department. So when people develop symptoms, they're going to need to call their primary care doctor, and their primary care doctors are going to be testing. If they don't have a primary care doctor, then urgent cares are also testing. But one of the important messages we want to get out is to call ahead. If you're going to your primary care doctor, if you're going to an urgent care, call ahead and let them know what symptoms that you have so that they can properly triage you and keep you from spreading it to other people at the doctor's office. Finally, I want to let you guys know that we are currently investigating and testing multiple individuals here in Wyandotte County. We encourage people to stay up to date. This is a constantly evolving situation. Additional information is going to be forthcoming. I believe that we're going to be watching the governor's press release at 6:30 in 10 minutes here. So there's going to be more information forthcoming about some of these individuals we're currently testing and investigating. Make sure that you keep up to date as this is a constantly evolving situation. Our website will have information, our social media will have information, the Kansas Department of Health and Environment will have information, so just make sure that you're keeping up to date because every day this situation's going to evolve, so it's important to keep up to date. Any other questions?
Commissioner Bynum.
Just to step back to the testing briefly, are you saying that our local primary care doctors and urgent care facilities have the tests available for those who need to be tested?
Yes, that is true. The testing does have to be approved through the Kansas Department of Health and Environment. Once your primary care doctor or urgent care gets approval for that test is available for them. We also have some test kits here at the health department that we can give to primary care doctors if they don't have the test kit available. It's not really a special kit. There seems to be a bit of a misconception about that, but it's actually similar to the kit that your doctor might have on hand to test for other viral illnesses like influenza. But primary care clinics in Wyandotte County are able to test, yes.
Thank you.
Any other questions? Administrator Bach?
And mine's not a question, I just wanted to kind of add to it from the perspective and the work that's going into this. So it's coordinating activity that the health department's doing and working with emergency management, working and communicating with other jurisdictions. Within Wyandotte County, we're scheduling meetings with the school districts to have a conversation with them about next steps, all steps that are going on. One thing that I look at, are all operational practices that are happening. As you know, about 90% of the employees we have in our workforce really need to continue working because this is our time where we serve. As we're out there from police, fire, sheriff's department, detention operations, our health department employees, our juvenile care workers, our employees that work with transit operations, Meals on Wheels, delivery of home services from that perspective really covers most of our forward-facing employees, and we need to continue to do that. We are taking steps to provide additional disinfectant, advise them, provide information to our employees about what they should be doing to take precautions when they come into different areas. So those are all steps we're working toward. But we're not in a position to say this is a time we don't show up for work. As Elizabeth said, we're advising people if you're feeling ill not to come. But otherwise, this is really a time when we have to step up, and this is when our employees really do work hard and they take care of this community. So I know that we'll be here to serve and go through it from this perspective, and we'll continue to do what we can to provide the additional resources they need as we go through this time.
Thank you. We have Commissioner Kane and then Commissioner McKiernan.
I don't know for sure, but somebody said that the Kansas City, Missouri Fire Department is doing something different. Could we check in to see what they're doing and see if their police department is doing something, and maybe we can kind of piggyback off of what they're doing?
They are doing things different. We've did some analysis of some of the things they are doing and verified it back toward what is the best practices, and we will move forward with steps we think are the most appropriate for us. I don't want to call them wrong versus us or what other communities are doing. There are different steps that are being taken.
Well, I'd like to at least know what they're doing in Missouri. Casey Moe.
Okay.
Commissioner McKiernan.
Thank you. You certainly have recommendations for us in terms of our personal hygiene, in terms of hand washing and not touching face and eyes and nose and mouth, and covering our coughs. Do you have any generic recommendations in terms of workplace hygiene, in terms of trying to maintain the cleanliness of keyboards and desktops and other items in a typical office?
Yeah, so the Kansas Department of Health and Environment actually did put out some recommendations, and I can email those out, or I'm sure somehow get those out to you guys so that you can see those recommendations. Anything that you can do to keep things cleaner is going to be a good thing. So there's certain cleaning agents that do kill coronavirus, we know. And that's part of the recommendations that Kansas Department of Health and Environment put out that I'll make sure that you guys get. Cleaning keyboards, work surfaces, all of that is going to be a good thing moving forward.
I might encourage you to give that consideration to our website to ensure that that information is available for all the public, that they'll be able to pull that information up directly.
Yes, KDHE has provided a list of different cleaning products and what they have to have in them, a certain amount of Clorox, a certain amount of alcohol in it, things like that. So that list we can make available to you all as well as on our website.
Any other questions from the commission members? Ladies, thank you for the information you've shared with us tonight. It sounds fairly simplistic, but this is a very fluid situation. Wash hands, avoid large groups, stay home if sick, contact your personal physician. Very solid, sound advice. And if there's not any other questions, I'd entertain a motion to adjourn, and we'll reconvene at 7 p.m. in the commission's chambers. Are we going to?
We were going to watch.
Well, we were going to watch the press conference.
Oh.
I don't know that we need to remain in.
Session? I don't know why we would.
Well, I guess if you stayed in session, if you wanted to have some public discussion about it, you could, so you could just,
Okay.
you know.
Well, then I'll recant the adjournment. We will we'll stay live, and we'll watch the press conference. And at that time, if there's any questions come forward, we'll address them. But we must adjourn by 7 p.m. and reconvene in the Senate, in the Commission chambers at 7 o'clock.
I will note, Commissioner, while we're waiting that to come up, if you did not see it, so this afternoon, when we did do the press conference, which the mayor, Ms. Garrison, and Dr. Greiner, our medical doctor, that information is out there on UGTV. They'll play back, but it's also on our YouTube. It was recorded, so you can go back and watch that through. I think you had about a 5-minute statement or so, Terry, and then the rest of the session went through from a Q&A, where the public came in and asked a lot of questions back to them, so that's available, as well as it's available on the Facebook Live account. You pulling it up?
How did you know?
It's,
I can help myself.
to assist where needed. This emergency declaration will ensure that we bring to bear the full resources of our government and appropriately respond to Kansas' specific needs during this time. I want to let every Kansan know we will use all resources necessary as we continue to mitigate the spread of this virus. It is also worth repeating to all Kansans, this is not a time to panic. Please continue to use common sense, hand washing, properly elbow, stay movement hill. This remains the best defense against COVID-19.
Great.
At this time, we're also suggesting practicing social distancing and avoiding large crowds. Kansans' health and well-being remains our highest priority. More recommendations will be released in the morning from the Department of Administration related to operations of the Capitol Complex. This will include limiting visitors to those who have business before the legislature. So please go to the Kansas Department of Health and Environment website, kdheks.gov, for helpful resources and daily updates on COVID-19 in Kansas. And with that, I'll turn it over to the Secretary of Health and Environment, Dr. DeMond.
Thank you, Governor. Of course, we're saddened to receive the news about the death of this patient today. We send our condolences to his family. This is a rapidly changing situation. We've had many daily conversations, and we've talked for a while now about what will be the new normal in terms of coronavirus, both globally in the United States and here in Kansas. be tested for this. We are going to be looking at this particular situation and apply the best guidelines we can to the testing of the other residents and the staff in the facility. We are working hard to keep everyone informed, and we know that you will have questions. Our website, as the governor points out, has the latest information updated daily, sometimes multiple times daily, and it's available at kdag.ks.gov. In the belief that there'll be questions tonight, we are standing up a phone bank, because I know when this information comes out, there'll be people who will want to know more information or have concerns, and it'll stand up until 10 p.m. It will also open again tomorrow morning during normal business hours. That number is 866-534-3463. That's 866-534-3463. With that, I will turn it over to Major General Lee Taffanelli, the Adjutant General of the State of Kansas and the Director of the Division of Kansas Emergency Management.
Thank you very much, Dr. Norman. Just to kind of update everybody on some of the activities from the department, of course, for the last several days, we've been ramping up our activities at the State Emergency Operations Center. We've been in contact with all of our counties, continuing to share information with the federal agencies that we work with, along with other state agencies, and still are very, very closely aligned with the Kansas Department of Health and Environment. As Governor Kelly had mentioned, that earlier this afternoon she had issued a state emergency declaration, and it does a couple of things. What it allows us to do is open up the Kansas response plan, and within that Kansas response plan, it allows us to bring in our emergency support function agency heads. So from each of the different agencies, each of the different emergency support functions, we're able to bring them in, and ultimately what that allows us to do is to begin to coordinate and synchronize resources across the state and really kind of help support those local communities should they have a request for additional assistance. It also gives us some additional flexibility with respect to contracting and purchasing in the event that we need to deviate from current practices with that. And then lastly, what I would say is we still have the same approach in terms of looking at this, and that is to look at it from a risk-based approach. And we look at each of those specific risks, then we apply mitigation strategies to that risk and work to mitigate that risk down to an acceptable level. Thank you.
I'm Laura Howard, the Secretary for the Kansas Fund for Aging and Disability Services. I wanted to speak specifically to the issue around long-term care facilities and our aging population and individuals who may have a compromised immune system. You know, what the tragedy of this circumstance reminds us of is the fact that COVID-19 is the most serious, and as we've seen in this circumstance, the most lethal for the elders in our population, and again, those with compromised immune systems. You know, just earlier this week, the Center for Medicare and Medicaid Services issued a bulletin to nursing facilities across the country and assisted living facilities, really detailing out best practices in terms of screening and restricting visitation to facilities, as well as some best practices around infection control. You know, our nursing facilities in the state are taking that very seriously. As you interact with those facilities, you know, on a personal, professional basis, you will see screening protocols that have been instituted, for example, to test the fever of visitors, to ask certain questions about travel patterns, and then in some cases, actually to restrict visitation even more severely, for example, only to those who need to come into the facility for a medical reason. So again, our facilities are taking that seriously. We will be looking to issue some further state guidance that complements that federal guidance probably tomorrow. But at the same time, I really also want to give a message to the public. I know it can be frustrating if you have a loved one who may be in one of these facilities, but know that those who are young, those who are healthy, who may not even have very much impact from COVID-19 can be the very carrier that puts the most vulnerable at risk. So this is a time we really need to honor those restrictions, understand why those are in place, and know that short-term things that may impact the ability to interact as personally with our loved ones are well worth it as we preserve the life and safety of our entire community. With that, I would turn this over to our local partners. Mr. Mayor.
Thank you. Hi, my name is David Albee. I'm the Mayor of the Unified Government of Wyandotte County, Kansas City, Kansas. I want to thank Dr. Norman. I appreciate the invitation to join in this evening in the spirit of cooperation. Of course, we are terribly saddened to learn that one of our own has passed away. Our thoughts are with his loved ones and for all those affected. Just this afternoon, our Public Health Department team and I held a Facebook Live news conference to share details of our preparation and recommendations to our community. In times like this, that reinforce our need to work together and for all of us to really adhere to the public health recommendations that are meant to keep our community safe. So if we were not taking these things seriously before, certainly it is now time to do so. Unified Government Public Health Department serving Wyandotte County has been and will continue to conduct a contact investigation, retracing the patient's steps so that we can identify anyone who may have been potentially exposed. During this process, we will continue to rely on the cooperation and support of KDHE and our local partners in the Kansas City metro area. And as we all know, the Kansas City metro area has been faced with public health challenges before. We persevered then, we'll persevere again. I'm very confident in the team of people who are looking at this minute by minute, always seeking to adjust the measures we need to take to assure that our public is kept safe and healthy. Unified Government will continue to update our community through our website and social media regarding this case and any other developments. Thank you.
We'll open it up for questions.
So this is a 5th confirmed case?
Okay. Yes.
Okay, and how do we have a death when we previously did not know that this case existed?
The patient wasn't tested till he came into the hospital and hadn't had any reason to be suspicious of it. It was thought to be a cardiac reason that brought him into the hospital, and it was through the course of his medical evaluation that it was viewed as a good idea to do this testing because he had a fever.
And this is the first instance of community, quote-unquote, community spread in Kansas, correct?
Yes.
And what does that mean? I mean, relative to the big picture.
Yes. Well, as a skilled nursing facility resident and one who's not mobile, really, he had to have gotten it from someplace. So it was by definition in the community.
You don't know how he got it?
Not yet. It's going to be what we would consider classic public health contact tracing to do the detective work to find out where this came from.
But I want to understand because what you just said is important in the sense that what I'm surmising by what you say is that because he was in a nursing home, he was affected by somebody who came in, which means you're not going to restrict the virus in any meaningful way to that facility. It's already out there, which is where it came in from the outside.
It came in with the person, yes.
How large a facility is this?
About 80 beds.
About 80?
It's not full of patients, but that's the bed capacity.
Can you name the facility?
We choose not to right now. It will become known, I think, in the very near future, but one of the things that, as you can well imagine, they're scrambling to put the protective measures in to start doing their work with their staff and the other residents just to assure safety. And I think it's really important that we not get in their way.
Can you say this much? I mean, Secretary Howard talked about the CDC guidance that came out earlier this week. Do you know whether or not this particular facility was following that guidance?
We do have reason to believe that they were. The initial investigative work that's been done by staff has been that they have done some of the limitation on the visitors and some of the things that are recommended, such as Secretary Howard commented.
But this would have been a facility in Kansas City, Kansas?
Yes.
And then he went to the hospital a hospital
Yes,
in that area?
Yes.
Can you say which
it
hospital?
was at Providence Hospital.
I'm sorry?
Providence,
Providence. And that was where he died?
yes,
When did he die?
yesterday morning.
Yesterday morning. Then I'm curious, he died yesterday morning. Why didn't you know about his death and the link to coronavirus earlier than
Because it
that?
was, the testing was done on course at a postmortem examination.
Okay.
What is the
Is that
turnaround
a
on
standard?
testing times?
I'm sorry.
What is the turnaround on testing times?
It takes, from the time the sample gets to our health and environment lab, it takes about between 4 and 6 hours.
Is that a standard practice to do postmortem tests in a situation like this?
You know, it's not necessarily 100% of the time are these things done. In this case, he came in and was in the hospital a relatively short period of time. So oftentimes, when a person comes in and they have a fairly rapid demise, it's done because it's really wanting to understand the cause of death.
When was he admitted to the hospital?
The day before.
So that would have been Wednesday?
Yes.
Okay.
Governor, you've declared a state of emergency, and does that affect what you want to do with people visiting the State House?
We actually had a meeting earlier in the day with legislative leadership and legislative administrative services, and we talked about what sort of mitigation strategies we wanted to implement here, and that decision was made before the state of emergency was declared.
So generally, anybody who doesn't have business before the legislature, you're going to ask them not to come to the building or keep them out?
I think the intent, and we're going to have this tomorrow morning, we will put out a release on this, so you'll have the details on it. I can tell you that we will be looking at canceling any large gatherings of groups that are coming in. You all are around here a lot, you know that every day we've got groups of hundreds and more in the rotunda or walking on the floor. So we will shut that down for a while because we just need to be able to provide public safety for those who work and do business here, but also for those groups that would be coming in.
But to John's question, I know the specifics in the morning, but what qualifies as business? And if people don't have a reasonable answer to that question, do you really say you can't name the company? Or?
Well, reasonable business would be, one, if you're obviously an elected official, you work for an elected official, or you're coming in or you work down a research or advisor's office. Those folks automatic. Then also we would allow the public who are coming to provide testimony before committees would be able to come in and do that. And I would imagine that the lobbyists would continue.
I was just wondering if all lobbyists would be barred.
No, they are conducting business before the legislature, so we'll let them come in.
Dr. Norman, I'm confused. John asked you, you said he was admitted the day before he died, so he was admitted Tuesday, died on Wednesday, or today's Thursday?
Yes, that's right. Yeah.
So
These
was it
days
a,
have been running together a little bit, I think.
was it a full 48 hours, Tuesday to Wednesday, or was it less than 24 hours?
It was less than 24 hours.
All right, one more question?
You said he was originally brought in on cardiac concerns, and then you later postmortem figured out it was corona?
He had an acute cardiac problem at the skilled nursing facility, and then when he got to the hospital, it was recognized that it was more than just that, and it was because he had a fever.
Now that you know that the virus is in the community, what can we expect in terms of, we've been counting these cases single-like then.
Yes.
So what's reasonable to expect?
Yeah, one of the things that we're going to do next, and it's a really good question, is we're going to look, among other things, at gatherings. At what point do we say that we would recommend the suspension of gatherings, much as you're seeing with the NCAA, Big 12, et cetera? I think we're going to come out with some pretty good guidance. We're going to, and that will likely be tomorrow.
But in terms of case number, so we're going to see
Well, we certainly could. The biology of the organism is that it can smolder along, pick up a few cases, and then take off rather steeply. That's why the containment right now are at the critical point before that curve. I would like to make one comment before we adjourn, and that's something that Secretary Howard said that I'd like to say to you before, and it's so critical, is that yes, young people are relatively spared, but in this context, it's really critical to understand that they can be carrying the coronavirus, even though they're not particularly ill, might be viewed as having a little cold or something. And it's really hard to, in a skilled nursing, to turn away visitors because people get lonely and they really benefit from the socialization. So it's balancing act. But it's one we will, those decisions will be made very carefully to, you don't want to deprive people of folks of socialization. But the other side of that's
I'm going to take this. Thank you. We're going to take this opportunity to adjourn this meeting, and remember, we will reconvene in the Senate, in the Commission chambers at 7 o'clock. Yeah, Unified Government Commission chambers at 7 o'clock.